Hi, my name's Ashley Hype, and I decided to do my project on tuberculosis. I decided to call it a global killer. So tuberculosis is caused by the bacteria Mycobacterium tuberculosis. When it enters the body, it primarily targets the lungs, but it also can affect the organs in the lymphatic system, nervous system, and circulatory system. When it enters the body, there's two different outcomes that can occur. The first is called latent tuberculosis, and this is when the person's immune system fights off the bacteria. So in this situation, the bacteria will be inactive within the person's body. They will not show symptoms of tuberculosis, and they will not be contagious. The second scenario is called active tuberculosis. In this scenario, the bacteria is going to go into the lungs, and it multiplies, causing pneumonia. And if this pneumonia is left untreated, then it'll begin to affect the kidneys, the bones, and the meninges that line the spinal cord and brain. This person is said to have active tuberculosis because they're contagious and they have the symptoms. Tuberculosis is spread through the air, so if someone with the bacteria spits, coughs, sneezes, or does anything that involves germs entering the air, there's a chance they'll catch it. But it's important to realize that it's through consistent close contact. So if we're in South Africa and we're interacting with someone with tuberculosis, which is probably might happen, that you're not going to get tuberculosis just by talking to someone or sitting with them for a few hours. But if your mother had it and you were hanging out with your mother all day in the same house, then you'd probably get the bacteria. So those who are more likely to get tuberculosis are those with HIV/AIDS, and they actually have a 12 to 22 times more likely to catch the disease. In addition to this, cancer patients, babies, those with kidney disease, or organ transplant recipients, seniors, and those who are malnourished all have a higher chance of getting active tuberculosis. This is simply because in all these scenarios, the immune system is already weakened, so it can't fight off the bacteria. In South Africa, tuberculosis causes over 60,000 deaths a year. This makes it the illness that causes the most deaths. In addition to this, in 2012, 500,000 people had active tuberculosis, and 80% of the population was found to have latent tuberculosis. So although latent TB is better than active TB, latent tuberculosis can become active tuberculosis at any time, so it is still dangerous. In the past, or during apartheid, treatment for tuberculosis was hospital-based, so the patient would spend 12 to 18 months in a hospital bed receiving medication. So obviously the problem with this is that it served as a huge burden for patients to receive treatment. So at post-1994, treatment became outpatient care. However, the treatment's still mostly based in the hospital. So now not only do those with tuberculosis have to come up with money to pay for the treatments, but they also have to come up with money to travel to the hospitals. So why does tuberculosis cause so many deaths? There's no direct answer to this question, but through my research, I determined that it's the social issues that also occur in South Africa. So as many of you know in this class, HIV and AIDS is extremely prevalent in South Africa. It has one of the highest prevalences in all of the world is in South Africa. In addition to this, malnutrition is extremely common in South Africa. So in 2010, 12.3% of deaths was somehow related to malnutrition. So the death was caused by malnutrition. Sorry. In addition to this, informal settlements, we all learned about those in class, or shacks. We learned about the close proximity of them. So in some scenarios, the housing situations, the houses are actually touching each other. So this allows tuberculosis to spread not only within the family, but also to nearby families and neighbors. Also, the healthcare system in South Africa, similar to many other healthcare systems, South Africa is composed of a private and public sector. The public sector serves 84% of the population, while the private sector serves 16% of the population. And this would be okay if the government gave money to the sectors accordingly. But while the government spends 8.4% of its gross domestic product on healthcare, only 4.2% goes to the public system, while 4.1% goes to the private system. So what this means is that 0.1% more money is supposed to cover 33.8 million more people. And obviously it doesn't work like that. So there's there's an indistribution of wealth, and there's not a lot of money in the public system. This influences doctors to often go into the private healthcare system. So while there was 38,236 practicing doctors in 2012, there's only one doctor per 4,219 patients in the public healthcare system. So just to compare this to the US, in the United States, it's one doctor per 329 people. So that's just showing how severe the lack of physicians is. Other problems that come from lack of physicians include long wait times and obviously high copayments. So high copayments serve as a huge burden for those who can't afford it, so it often prevents the poor to not go to the doctor. So tuberculosis affects the entire world, not just South Africa. So in 2012, 8.6 million people were diagnosed with active tuberculosis and 1.3 million people died. Asia was found to have the highest percentage of new cases. However, I'm sure we all know from the map quiz how large Asia is. And when you take into account population, sub-Saharan Africa actually has the largest amount of new cases per population. So in India, every 2 minutes, 3 people die of tuberculosis. And in China, last year, there was a reported 1 million cases of active tuberculosis. So I thought it would be interesting to compare the social issues in India and China to that of South Africa. So all 3 countries actually have a lack of physicians, high medical treatment costs, so that prevents people from going to the doctor, as well as severe malnutrition and close living proximities and poor living conditions. So I thought it was interesting because if you kind of look on a map and you look up social problems around the world, tuberculosis rates are more common in those with higher social problems. So in the United States, 14 million people will be exposed to the bacteria that causes tuberculosis. Does anyone know anyone that's had TB? Okay, has anyone been tested for TB? Okay, so most of us know how it goes. You go to the doctor, they stick a needle in your arm, you go back a couple days later, and they tell if you have a rash or if you have a reaction to the shot. So on your right, that's what happens if you have a reaction to the shot. That means you've been exposed to the bacteria. The left is when you have not been exposed to the bacteria. So if your skin test comes out positive, you go to get an x-ray and they determine whether or not you have latent or active TB. So the thing about this is in the United States, whether or not the person has latent or active, they're going to be treated. So they're going to receive medications over a series of a few months to get the bacteria out of their system. This is different than in South Africa where the latent population is not being treated at all or even considered to be treated. So I think this is important because I think this is why the United States has had so much success in overcoming tuberculosis. Also, obviously, in the United States, social issues such as malnutrition, HIV/AIDS, all of that's not as high, so that also leads to it, and the fact that access to a doctor is easier. So researching tuberculosis and around the world and the healthcare system in South Africa brings up a key question, and that's, is healthcare a right? So the answer actually varies based on what country you're in. So in the United States, healthcare is not a right. It's never been deemed a right. Instead, it's more of a product, so it's bought and sold. It's not something that's universally considered necessarily. However, Obamacare just became infiltrated. So this is interesting because this shows a shift of the United States government viewing healthcare more of a universal necessity than it has been in the past. So shockingly, South Africa actually does consider healthcare a right. Section 27 of their constitution guarantees them the right to healthcare. Obviously, through this presentation, you can tell that everyone's not receiving healthcare, and through what we've learned in this class. And I actually found a court case that openly denied a man treatment with renal failure. So he went to the courts to fight for medical treatment, saying that it was his right, and the courts denied him, saying that medical treatment should be saved for preventative action, as well as for people without life-threatening illnesses. So I thought this was extremely ridiculous that this man, they tell him it's his right, but then they're not going to follow through and actually give him medical treatment. And also, they're saying they're not going to treat people, or they don't have to treat people who have life-threatening illnesses. That includes TB, that includes AIDS, that pretty much includes anything that someone contracts when they have a weakened immune system, because a lot of illnesses can lead to death. So I just think it's crazy that they're able to do that. And South Africa has finally started to notice how severe the tuberculosis rates are in their country and the problems with their healthcare systems. So they're beginning to create plans and strategies and administer them within the country. So this year they started a plan, national financing plan, that would help with the healthcare system. So it should be interesting. That should be implemented within the next 14 years. So watching South Africa over the next few years should be interesting to see how their healthcare system evolves and how tuberculosis rates increase or decrease. That's it. Does anyone have questions?
Okay, so if we came back and got tested for TB, would we show up a rash just because we were around the disease, even though it might not be active?
Okay, it's mostly consistent exposure, so chances of you catching it are slim. But if you are exposed to it, you'll come back. You'll have a skin test. It'll come up positive. If you're not coughing or anything, they'll give you an x-ray just to make sure that it's not active. And when it's not active, they'll give you an option of treatments for the latent TB. I think it's a 6-month like medical treatment plan that you can get, but it's not mandatory, but they recommend it.
Other questions? Why did you pick this topic of tuberculosis, and what did you find most fascinating?
Okay, I picked tuberculosis because I'm a health science major, and at first I wanted to kind of look into AIDS and HIV, but when I found out that tuberculosis causes the most deaths, I thought it was interesting because you don't really hear about tuberculosis. You always hear about AIDS and HIV around the world, but tuberculosis is kind of something that causes so many deaths, but it's not really recognized. So I thought it would just be interesting to research something that's not widely publicized about.